So, hello, nice to tell you a new lecture, and I'm happy to explain you some new informations. This time, this topic about the structure or the basic structure of the eye, and then in the last minutes, of course, also the basic structure and the basic composition of the ear. So let's start with the eye. So here you see a nice scheme of the whole eyeball with the basic layers. So let's start with the basic description of the anatomical parts. So I think the basic measure is this measure from this point till this point. Yes. So the eyeball is approximately in this axis long, maximum 25 millimeters. At this moment we can see three basic layers. The most outer layer, this one, number one, is so-called the Tunica Fibroza. In this place, from this point back, you see the whole sclera. Yes, sclera. And here in the front, ventrally, we see this very transparent layer, and this is the cornea. The sclera is from irregular dense connective tissue composed, and the cornea has a special composition that we will explain in a few minutes. The pink, the middle layer, number two, I will make such a small number two, the middle layer. Yes, is Tunica vasculosa, in another name, uvea. And from this point back, this point is called ora serrata retinae. From this point back, we call this Tunica vasculosa choroidea. And in front, you see that the uvea is running into such a typical body with processes, a ciliary body. Yes, ciliary body with a muscle inside. And front it runs on forming the iris. So this is the middle layer of the eyeball. And now we come to the most inner layer, and this is this number three, the yellow, number three, yellow. And this is the retina. Pars nervosa or tunica nervosa of the wall, and you see in this region from ora serrata retinae, from this point the retina is very thick, much thicker, also on the scheme. That means this is the optic part of the retina, pars optica, optic part of the retina, and from this point front, ora serrata retinae front, ventrally, we can call this part of retina the blind part of the retina, pars ceca blind, pars ceca retina. And this pars ceca, as you see, is covering the surface of the ciliary body and running on and covering the posterior surface of the iris. So logically, on the surface of the ciliary body, this blind part is called pars ciliaris retinae, and on the posterior surface of the iris we can call it pars iridica retinae. The biggest part which you see here is the chamber for the vitreous body. So here is the vitreous body, this part. What you see here is nicely this channel, this very thin channel, which is here described. Canalis hyaloideus, or in another name, Canalis glauceti. And this small channel in the vitreous body is a remembrance on the development of the eye, that the lens was getting a nutrition, or the cells of the developing lens were getting nutrition thanks to the hyaloid artery and hyaloid vein, which were running here in this region to the developing lens. So this is a transparent lens in this moment, and this is the small channel is such a remembrance on the hyaloid artery and hyaloid vein which were running to the developing glands and giving nutrition to the cells. The last very important thing, we have here a small piece of the optic nerve. Of the optic nerve, you see coming out from the eyeball. So in the optic nerve here are many axons. We will see in few minutes a detailed picture. Many axons in the optic nerve covered with the meninx, because this is a part of CNS, please. This is not a peripheral nerve, this is a part of CNS. So logically, it's covered with the dura mater, arachnoid, and pia mater on the surface. This is the first important information. And the axons has got a myelin sheet, of course, in this region, in this part. They are getting a myelin sheet. And this myelin sheet, when we are in CNS, is logically formed by oligodendrocytes. Oligodendrocytes. Here is a detail from the anterior segment, half from the anterior segment of the eyeball. So we can repeat the outer layer, which you see here. I think you can read it very nicely. So this is a dense connective tissue, the sclera, and here is a transparent ventral part, the cornea. Yes. This is the iris. Iris, you can see nicely. This is the lens, yes. And this is a very interesting thing, such very thin microfibrils containing elastin and fibrillin. So they are very similar in the composition to elastic fibers. And this is the holding apparatus of the lens. It's called zonula ciliaris zini. This holding apparatus of the lens. You see that the microfibrils are attached on one side to the capsule of the lens, on the other side to the epithelial cells on the surface of the ciliary body. So this is the holding apparatus of the lens. Nicely we see a small piece of the ciliary body, and we see nicely musculus ciliaris, the smooth muscle, musculus ciliaris, yes, with the typical fascicles of smooth muscle cells, yes. These are called the meridional, the circular, tangential running of those radial running of those smooth muscle cells. So this is a very important ciliary muscle, musculus ciliaris, for the accommodation. And now we have here two important chambers. The first, bigger, larger chamber is between the cornea, the iris. Here is the pupil. Here is the hole, the pupil. Yes. So, of course, also in front of the lens, because here you see the lens nicely in the pupil. So, then this is the anterior chamber of the eye. Camera will be anterior. And now, a very small chamber which is behind the iris. So, on one side you see the posterior surface of the iris, slightly the surface of the lens, the holding apparatus of the lens, and the ciliary body from this side. And this small chamber behind the iris is camera bulbi posterior, the posterior chamber. Only this small space, please. Don't mix it with the vitreous chamber, which is behind the lens, and here is the vitreous body. So this is the last and the biggest chamber, the vitreous chamber for the vitreous body. So here is the anterior chamber and here is the posterior chamber. Two important chambers in which in both is humor aqueous. This special fluid is filling those two chambers. And here is a section, the anterior segment of the eye. This is from the light microscope. I have done here a little bit a small scheme of the lens, because the lens sometimes during cutting of thin slices on the microtome is not holding perfectly, not staying here, and is falling out. So we have some slides where the lens is present, and some slides, don't be surprised, please, at the microscope, the lens will be missing, will be not present on the anterior segment of the eye. So you can imagine still the holding apparatus of the lens. I am doing here the few microfibrils running from the lens to the ciliary body. Yes. So in this moment we see nicely the cornea. Yes. We see perfectly behind the cornea the anterior chamber. We see perfectly on a section the iris, and here the iris. Logically on a section we see in two places the ciliary body, yes, here and here, yes. The sclera is here, please. This is dense connective tissue. Yes, the vitreous body is automatically behind the lens. And I am now once more repeating that this small space here, where I'm doing the small red crosses, is the posterior chamber in the eye. So I think it's very simple and very clear to understand the basic anatomical structures also and as well in the light microscope nicely. So wait something, such a picture you can wait from the light microscope when we'll study the slide, the anterior segment of the eye. And now let's look what you see in the corner here, that we can now look on the detail structure of the transparent here layer cornea. So, and here you see the cornea in a more detailed histological picture. This is front, here is the air in front of the eyeball. This is this part, yes, here is the air in front, and here back is the anterior chamber, please. And here is the anterior chamber. So this is the posterior surface of the cornea. So, and here is the humor aqueous in the anterior chamber. So let's go from number 1 to number 5. All the layers, all the basic layers of the cornea. So you see here in front, we can see a nice, perfect, stratified, squamous, non-keratinizing epithelium, stratified squamous non-keratinizing epithelium, but not many layers, as you see. The cornea here with this epithelium has got about 4 to 5 layers. You see, you can even count them thanks to the nuclei. You see, so 1 layer, 2nd layer, 3rd layer, 4th layer, and the flat cells on the surface. Yes, here's the 5th layer. So maximum 4 to 5 layers of this anterior epithelium, or the front anterior epithelium, covering the anterior surface, the ventral surface of the cornea. Next layer, number 2, is only this thin layer, and it's called the Bauman's membrane. The Bauman's membrane with some collagen fibrils present. Yes, and it's a very important and ground substance, yes, and it's a very important protecting layer, the Bauman's membrane, thick 7 to 12, yes, it's written, the Bauman's membrane thick 7 to 12 micrometers. In this moment, when you see 7 to 12 micrometers it's thick, you can see it also very nicely in the light microscope, the Bauman's membrane. And now is the thickest part of the cornea, and it's from here till here. And it's the stroma of the cornea. In another name, which is also precise name, is, as you can read, substantia propria cornea. Substantia propria cornea, in another name, the corneal stroma. So in this moment here are parallelly lying lamellae, which are composed from collagen fibrils in those lamellae. So here are many flat lamellae full of very thin collagen fibrils, and you see the flat nuclei here, the elongated flat nuclei of such here flattened fibroblast. So this is one important part of the stroma. The next important part is keratin and chondroitin sulfate, and the proteoglycan lumicam is present. Interesting name you can read in some books for those very flat fibroblasts in the stroma, because they are very perfectly pressed by the lamellae, and the same processes looks like something similar to the wings of a butterfly. You know that the wings of a butterfly are very thin. So even in some books you can find an interesting name for those fibroblast butterfly cells. Very interesting name, butterfly cells. So I think that I've explained now very clear that we mean the thin processes of the fibroblasts which are pressed between the lamellae. Of course, this you could see only in the electron microscope, not in a light microscope, but the thin processes you can see on electronograms. And that's the reason why some histologists has given this interesting poet name to those cells, butterfly cells. And now we come to number 4. This is a very thin layer, which was described by a French doctor, Jean Desmais was his name, and he described this very thin layer, so it's called the Descemet's membrane, thanks to the name of this French doctor. And in fact, it's the basement membrane, or lamina basalis, of the cells which are covering the posterior surface of the cornea. So in fact, it's a basement membrane, the Descemet's membrane. And now we are at number 5 at last. And in some books, of course, you can find the name posterior epithelium of the cornea, and in many histological books you can find the name. It's the endothelium, in fact. Endothelium developed from mesenchyme cells. They are not so flat, those endothelial cells. They are more slightly cuboidal shaped, not so flat, but in fact covering the posterior surface of the cornea. And behind, you are in the anterior chamber of the eye, and there is the humor aqueous present in the anterior chamber. So you see the whole cornea has got 5 basic layers, please. Yes, that's very simple, just to know a little bit more details. The anterior epithelium, stratified squamous, non-keratinizing. Bauman's membrane, number 2. Number 3, substantia propria corneae, or the corneal stroma. Number 4, Descemet's membrane. And number 5, the posterior epithelium or the endothelium on the posterior surface of the cornea. It's a very nice transparent layer. So you see the most important thing here are not present vessels. So the cornea is avascular. It's avascular, getting nutrition from the sides, from the sclera, getting nutrition the cells, and from the humor aqueous. From the humor aqueous is getting the nutrition, and from the capillaries which are just on the side of the cornea. If you find and if you can see vessels inside the cornea, this is not a normal physiological situation. That means the infection is running in the cornea, or infection happened in the cornea if there are suddenly present vessels. So I think it's very nice, clear histological description for you of the cornea. So what we see on this picture, so we have moved slightly to the angle between the cornea and the iris. So we are on the side of the cornea, because you see this still is a transparent cornea, and from this place you can see already the dense connective tissue of the sclera. So somewhere at this place is the borderline. You see that the anterior epithelium of the cornea is running on and changing into the epithelium of the conjunctiva. Yes. Yes. And now here is the anterior chamber. Yes. Yes, 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 yes. Behind the cornea, in front of the iris. This is the anterior chamber. And just behind the iris, if you remember, is a small space, the posterior chamber. Posterior chamber in the eye. And this nice detail is showing you the ciliary body. So here you see the smooth muscle cells of musculus ciliaris, the ciliary muscle. Yes, so this is here. You see the processes, the interesting processes coming out here on the ciliary body. Yes, covered with the blind part of the retina. Pars ceca retinae is covering the ciliary body and running on the posterior surface of the iris. So this is pars ceca retinae covering the ciliary body and the posterior surface of the iris. You can imagine only slightly the microfibrils of the holding apparatus of the lens running to the lens in this moment. Yeah, because I would like to separate for you better, that you understand that behind the iris, this small space is the posterior chamber of the eye. So, and last two informations. In the angle, which is here nicely opened, you see, the angle is opened. So we see here such small spaces in the angle, in this region. And this is such a meshwork, trabecles, very thin trabecles, surrounding those spaces. And the spaces were described by Mr. Fontan, so-called the Fontan spaces. They are lined with endothelial cells, because endothelium, you see, is covering the posterior surface of the cornea. So those Fontan spaces are also lined with endothelial cells. And through these spaces is running out humor aqueous from the anterior chamber, running on, connecting these chambers, and they opened into the canal of Mr. Schlemm. It's a venous sinus, in fact, and also lined with endothelial cells. And from this channel, the humor aqueous runs back into the venous blood. The humor aqueous is produced on the ciliary body from blood, filling the posterior chamber in the eye, through the pupil running into the anterior chamber of the eye, from the anterior chamber of the eye running into the Fontan spaces, from the Fontan spaces on the canalis Schlemmi, the Schlemm's channel, and back into the venous blood, into the veins in the sclera. So this is a very important circulation of humor aqueous in your eye, in your posterior chamber, anterior chamber, and coming back into the blood. A detail that you see much better the spaces of Mr. Fontan, and those nuclei belongs to endothelial cells which are lining it. And in the corner you see little bit a part of the canal of Mr. Schlemm. So the pointers are showing you how runs out the outlet of humor aqueous from the anterior chamber. You see the smooth muscle cells of musculus ciliaris, and here slightly you see the processes of the ciliary body. In this moment, this angle you see perfectly opened, and so it should be this problem in many human, that the angle is so nicely opened, that the Fontan spaces are opened, and there is not a problem for the humor aqueous to run out into the fontan spaces and into the channel of Mr. Schlemm. Next is a very loose connective tissue. Loose connective tissue which is above the muscle. Loose connective tissue. Yes, perfectly blood supplied here, mainly in the processes, capillaries. Loose connective tissue on the ciliary body, and you see also the loose connective tissue as a basic stroma in the iris. So once more, the humor aqueous is produced on the ciliary body, filling the posterior chamber, through the pupil running into the anterior chamber, from the anterior chamber into the fontan spaces, and into the channel of Mr. Schlemm. And here is a detail from the surface, of the processes on the ciliary body. So the next picture is showing you the detail, yes, on the processes of the ciliary body. So, the ciliary body is covered by the blind part of the retina, pars ceca retinae. Pars ceca retinae, composed from typical pigmented epithelium, and above this epithelium on the surface are such cuboidal or slightly columnar shaped epithelial cells, and over those epithelial cells is produced the humor aqueous from the blood, from the capillaries. So from the blood is produced humor aqueous in this direction. So it's a fluid transporting epithelium in this moment with many connections, cell junctions like zonulae occludentes are between those cells. Yes, and those cells even has got a basal labyrinth near the pigmented epithelium. A nice basal labyrinth, two characteristics important for this epithelium. So at this moment from the blood is produced the humor aqueous over the pigmented epithelium and over this transporting interesting epithelium on the surface. So we see a detail from the surface of the ciliary body. Maybe you have heard about this disease. It's a very unpleasant disease, glaucoma, and it's a problem that the eye intra-ray pressure is running up. Intra-eye pressure is increasing thanks to this outlet of the humor aqueous from the anterior chamber. That's the problem. When the angle is not perfectly opened but slightly closed, that means the iris is running out something like here. So the angle is much smaller and is partly closed or can be completely closed. That means in this moment when this angle is not so opened, the humor aqueous cannot go out perfectly into the fontan spaces. That means he's staying in the anterior chamber. But ciliary body is producing a new amount of humor aqueous all the time. So the pressure in the eye, mainly in the anterior chamber, is higher and higher thanks to a bigger amount of humor aqueous. And this big pressure is logically pressing, the humor aqueous is pressing on the cornea from inside. That means it's a very painful disease because there are sensitive nerves in the anterior epithelium. There are free nerve endings between the epithelial cells in the anterior epithelium of the cornea. So the pressure is very unpleasant and is very painful for the patients during acute glaucoma. And the bigger pressure on the opposite side, that means on the vitreous body. Means that there can happen the compression of the axons in the ninth layer, in the optic part of the retina. We are in few minutes, we are in the optic part of the retina, and this pressure on the axons, and the axons are coming out from the multiple ganglionic cells in the optic part of the retina, means the result that the ganglionic cells can slowly die and vanish. So there is a very unpleasant situation during this disease. First, the big unpleasant pain in the eyeball, and the second, when it's lasting very long, you can lose some ganglionic cells in the ninth layer of the optic part of the retina. So this is this unpleasant disease, glaucoma. Now we see a detail from the iris. So here is the anterior chamber. So this is the direction to the cornea. And here, I forgotten to write it, sorry, here is a posterior chamber, behind the iris, posterior chamber. So I think you know these two basic chambers already where they are. So this is the posterior surface of the iris, and this is the anterior surface of the iris. Humor aqueous, of course, is here, and of course humor aqueous is here. Yes. So, what we see on the front? Here on the front, we see, of course, the same cells which were covering the posterior surface of the cornea, because from the angle, the endothelial cells are running on the anterior surface of the iris. And just under them, we see such stellate fibroblasts and stellate melanocytes present here, stellate melanocytes producing pigment, yes, melanin. The same procedure like melanocytes in the epidermis. The more melanocytes in this region, the more pigment melanin in this region, in the anterior limiting membrane, and that means your iris has got its typical color, thanks to those stellate melanocytes and fibroblasts which you see. The more pigment, the color of your iris is more dark brown till black color. Very less melanocytes, and little amount of pigment. Your nice and perfect color of your iris is light blue in this moment. The melanocytes are occupying and starting to produce melanin after childbirth, because if you have seen newborn children, has all has got light blue color of the iris, and the definitive color, which will not change anymore, the definitive color of the iris is developing around the fourth year of their life. Then it will be the definitive color of their iris. Now you see the stroma. So I have said already, it's a very nice loose connective tissue with typical nice capillaries, rich vascularization. Yes, and this is important to know, that here are many capillaries, many arterial venous capillaries in the stroma of the iris, because in this moment, when you have a disease which is called albinism, so you can see at these patients or these people, you can see not only the typical whitish white skin, one clear characteristic, but if you look on the eyes and you see the iris they have got typically red, and that's the problem, that there is missing pigment melanin in the anterior limiting membrane, and you see the blood in the capillaries in the stroma, because there are many capillaries, and you see the blood which is so shining out from the capillaries, and that's the reason why you see the typical red color of the iris at this hereditary disease albinism. Now let's move to the posterior surface. So here you see pigmented epithelium on the surface, pigmented epithelium on the surface, yes. Posterior pigmented epithelium, and above is a layer of myoepithelial cells, also pigmented myoepithelial cells, forming in this region along the whole iris, musculus dilatator pupillae. Musculus dilatator pupillae is from myoepithelial cells in this posterior limiting membrane of the posterior surface of the iris. Myoepithelial cells, musculus dilatator pupillae. Musculus sphincter pupillae, please, is, this is, you see, musculus dilatator pupillae, so in this region are the myoepithelial cells, yes, and on the apical part, you see smooth muscle cells here, and this smooth muscle is musculus sphincter pupillae. So these are real smooth muscle cells in this region. So here is the anterior limiting membrane of the iris, yes, here is the stroma of the iris, musculus dilatator pupillae, and the pigmented epithelium on the posterior surface. And in this apex of the iris, you see accumulation of smooth muscle cells, and this is musculus sphincter pupillae. So, a few words about the lens, because it's the next very important transparent structure in your eyeball, the lens. In a human, diameter is around 1 centimeter, 3.7 to 4 millimeters in thickness, very important for the accommodation of the lens. Refractive index of the lens is 1.44 to 1.55. So, the first very important information is transparent. No vessels, any vessels in the lens, any vessels in the cornea. And now the holding apparatus of the lens, if you remember, zonula ciliaris, zinii, those microfibrils of very thin elastic microfibrils composing this holding apparatus. And what we see on this detail, a small picture from the anterior surface of the lens, that means this is the direction ventrally to the anterior chamber. Why? I know it's ventrally because I see this cuboidal epithelium. And this cuboidal epithelium is just under the capsule and is present only on the anterior surface piece. So I know automatically when I will see this in the light microscope that this is the anterior surface of the lens. That means direction to the pupil, direction to the iris, direction to the anterior chamber. And here back on the back surface, this epithelium is not present. It's not present. So here we see nicely the capsule on the surface. Yes, in fact, it's a modified lamina basalis for those epithelial cells, containing collagen type 4. Yes, the basic components of a normal basement membrane, in fact. And now, behind the epithelium, behind the simple cuboidal epithelium, we see elongated, nice, very long lens fibers, yes, which are developing from the epithelial cells. During the development of the lens, there are some types of lens fibers. During the development of the lens, they have special names. This is, I think, in this moment not so important. But you see nicely elongated lens fibers containing some types of proteins which are called in one general name crystallins. There are some subtypes of crystallins. They have got some letters, the subtypes, and the crystallins are now inside the cytoplasm of those elongated lens fibers. So also the center which is called the nucleus of the lens, the center of the lens, yes, also lens fibers. So the capsule, to the capsule are attached the microfibrils of the holding apparatus of the lens to the capsule, yes. The anterior epithelium, simple cuboidal anterior epithelium in the lens, and the rest of the lens is filled with those elongated lens fibers. It's a complete transparent structure. Of course, during age, the transparency of this structure of the lens fibers can be different and can slowly move, and you can lose the patience, or the older people are losing the transparency of this lens, so they have such a feeling suddenly that they see the surroundings in front of them, they see the surroundings like through a whitish white fog would be in front of them, and that means the transparency is lower and lower of the lens, and this disease is called the cataracta, or the cataract. This is a problem. Of course, today, when this happens to the older people, it's not a problem to simple operation to open the cornea carefully, to get to the lens, carefully taking this not transparent lens out from the eyeball, and carefully giving inside an artificial lens, which will be once more nicely transparent. So the patient, after this operation, which is today lasting around 20-25 minutes, suddenly he sees once more very nicely the fog in front of his eye is away. So this is today a very nice help to those patients, replacing their lens with a artificial or plastic lens. And we are moving in this moment through the vitreous body to the optic part of the retina. Pars optica retinae. Pars optica retinae, with the basic layers, with the basic, as you see, each books has made the same number with 10 basic layers of the optic part of the retina. So it would be nice if once you see, or someone will tell you this name, pars optica retinae, optic part of the retina, if you would immediately remember 10 layers. Now number 10 should jump out from you immediately. So how is orientated this picture? Down here is the first layer of the retina, and this is the pigmented epithelium. That means under the pigmented epithelium there is a membrane of Mr. Bruch, the Bruch's membrane, is already tunica vasculosa, the choroidea. So this is down on our scheme here, and on the opposite side, above this internal limiting membrane, above this membrane here, this one, is the vitreous body. In the vitreous chamber. So is orientated our 10 layers in this moment, from the pigmented epithelium up to the vitreous body. So we will speak about some interesting neurons and very interesting cells in this optic part of the retina. But here you see very interesting cells described by Mr. Miller, so-called Miller cells, and you see they are very important supporting cells, in the optic part of the retina, for all, as well for rods and cones, and as well for all other types of neurons in the optic part of the retina. There are very long columnar cells touching the vitreous body on this side, and on this side they are forming this external limiting membrane just around here those processes of rods and cones. Mr. Miller was a German anatomist. Yes, Mr. Heinrich Miller was a German anatomist studying and working at the university in Würzburg in Germany. He died 1864. He died very young. He died, what is interesting, he died very young, in 43 years he died, Mr. Miller. But he left us those interesting cells. He described them for the first time in the optic part of the retina, because he was working the whole life in ophthalmology and describing and searching new things in the eye. So this is one interesting cell he left us. And the second thing, he left us he described for the first time the pigment rhodopsin. So he is the author of those interesting two names. A human eye has got about 8 to 10 million of Miller cells in the optic part of the retina. 8 to 10 millions of Miller cells. So you see, they are sitting in the optic part of the retina, one to another, and their processes are forming membrana limitans externa at this place, and near the vitreous body, membrana limitans interna, the internal limiting membrane. There are nuclei, and the basic part of the body are sitting in so-called number 6 in the inner nuclear layer. So these are the most important supporting cells. We count them automatically to the neuroglial cells. In some histological books you can find that they are taking them even to the group of macroglial cells, because they are really little bit long and little bit large Miller cells. But let's leave the information, they belong automatically to the neuroglial cells. The next neuroglial cells, which you can find in number 9, in this layer, you can find even here astrocytes, and even microglial cells. So you see that we are slightly, thanks to neurons, to neuroglial cells, astrocytes, microglial cells, we are in fact in the part of CNS, in the optic part of the retina in this moment. Pigmented epithelium, retinal pigment epithelium. So this is the first and the most outer layer, that means at this place, pigmented epithelium. So there are any cell junctions between those cells and rods and cones. They are just sitting on the pigmented epithelium, surrounded by longer processes of the cells of the pigmented epithelium, and as well surrounded by shorter microvilli, which has got this pigmented epithelium. So this is the first informations. The second absorbs light. Yes, that's the function of the pigmented epithelium. Yes. Isolation, yes, from blood, barrier function, and phagocytosing. Phagocytosing the rest of the membranous discs, which are in the outer segments. These back lines are the membranous discs in rods and cones, and they can phagocyte the rest of these membranous discs from rods and cones. So they are very important cells. The pigmented epithelium is a very important layer, the first layer of the optic part of the retina. And that's a famous place, this place. You see what has changed? A thicker layer of the optic part of the retina. Optic part of the retina. This line is the pigmented epithelium. Pigmented epithelium. Here is the vitreous body. And at this point, how the retina is much thinner, and from this point, ora serrata retinae, you see the blind part of the retina. That means this direction is leading to the ciliary body. You see the circle, this point is at this place, and on the section at this place. So front, we move to the ciliary body, and of course back we move with the optic part of the retina to the optic nerve, to the nervus opticus. So this is a famous place where the optic part of the retina is ending, and on ventrally front is running the blind part of the retina. So here are once more another scheme that you can imagine all 10 layers of the optic part of the retina. This time it's opposite, so I am doing here the pigmented epithelium, the first layer, pigmented epithelium, yes, outer and inner segments of rods and cones, membrana limitans externa, you remember the connected processes of Miller cells, outer nuclear layer, outer plexiform layer, inner nuclear layer, inner plexiform layer, the place where are the bodies and nuclei of ganglionic cells, the number 9 where are running axons from those ganglionic cells to the nerve optic or the nervus opticus, and number 10 membrana limitans interna, once more connected processes of Miller cells. So you see it in the light microscope. So you can imagine the pigmented epithelium, the first layer of the retina. You see the outer and inner segments of rods and cones. You see in a small magnification the outer nuclear layer, plexiform, inner nuclear layer, ganglionic cells. You see the bodies and the nuclei of ganglionic cells, and here are running the axons in layer number 9, and this is the inner limiting membrane, this line. So here is the vitreous body. So of course in a light microscope you cannot see the inner and outer limiting membrane. You can see them in an electron microscope very nicely, but slightly you can imagine that the inner limiting membrane is here on the surface of the optic part of the retina present. And here you can see it nicely described in more details. So, retinal pigmented epithelium. I see it's very nicely seen. Yes. Rods and cones, but please, not the whole cell. The outer and inner segments of rods and cones. That's okay. And now here we see this line. You see this line, and this is the outer limiting membrane. The processes of Miller cells. Here is a basic part of rods and cones, that means the body with the nuclei of rods and cones. Rods and cones here has got the nuclei. Yes. So the outer nuclear layer. Yes. Rods and cones are primary sensory cells. Primary sensory cells, their short process is a modified axon, of course, when they are primary sensory cells. And these short processes of rods and cones are in a synapse, in a connection with dendrites of bipolar neurons, of course, and horizontal neurons. Yes. So this is the outer plexiform layer. Yes. The inner, when this was the outer nuclear layer, so here's the inner. So here, logically, are the nuclei of bipolar neurons. In this layer are nuclei of Miller cells. In this layer are nuclei of horizontal neurons. And in this layer are the nuclei and bodies of amacrine cells. Very interesting cells, amacrine cells. These are interesting neurons with more processes, not one, more processes, but functionally the processes all are dendrites. To amacrine cells is missing the axon. So all those cells has got the bodies with the nuclei in the inner nuclear layer. 1, 2, 3, 4. All those cells has got the nuclei and the basic part of the body in this layer. When it's a bipolar neuron, logically, when it's got a dendrite, so also a bipolar neuron has got an axon. And the axons are running out from bipolar neurons into this inner plexiform layer, and the dendrites of bipolar neurons are in synapses. Those axons of bipolar neurons are in synapses with dendrites of the ganglionic cells in the inner plexiform layer. These are the bodies with the nuclei of the multipolar ganglionic cells. You see the light nucleus with the nucleolus and automatically sign for a neuron. So, and here are coming out the dendrites. But now the axon of those neurons is running in layer number 9 in the direction to the optic nerve, and those axons will be forming the optic nerve. So they are running to the blind spot in the eyeball. Axons from those ganglionic neurons. And even you see here the nuclei of some astrocytes in this 9th layer. So this is the nerve fiber layer, number 9. And of course, if you remember, number 10, the last layer, is the inner limiting membrane, once more the connected processes of Miller cells. And here is a vitreous body. So I think this scheme is very nice, describing the optic part of the retina. The same you see here. The short processes, something like axons of rods and cones. The dendrites of bipolar neurons. Their axon, connection, synapses with dendrites of ganglionic cells, and the long axon coming out from the ganglionic cell. So you see the similar scheme, similar situation on here. This is the outer nuclear layer, and this is the inner nuclear layer. This is the interesting amacrine cell. You see it has got more processes, but functionally are all dendrites. To this cell is missing the axon. This is a nice detail that you see 1, 2, 3, 4 layers, first 4 layers of the optic part of the retina. The pigmented epithelium is sitting on the Bruch's membrane, and here you see the cells of the pigmented epithelium, the first layer, yes. You see even the nuclei, yes, and you see the pigment, yes. And this is the outer segment of rods and cones here. From this place is the inner segment of rods and cones. So this is the inner segment of rods and cones, and these are the outer segments of rods and cones. And here is this line, membrana limitans externa, the connected processes of Miller cells. And you see the bodies and the nuclei of rods and cones. That means the outer nuclear layer. So we see 4 layers here. Number 1, number 2, number 3 and number 4, the 4 first layers of the optic part of the retina. In the corner you see the thick collagen fibers of the sclera and nuclei of some fibrocytes, and this is the choroidea. This is a choroidea in this moment. Rods and cones are primary sensory cells. That means modified neurons, in fact. Primary sensory cells are rods and cones, and primary sensory cells are sensory cells in the olfactory epithelium. That means they have a very changed, differentiated, very nicely differentiated, in fact, dendrite, and they have also got a very short axon when they are modified neurons, in fact. Primary sensory cells. Primary sensory cells. This red line is showing you the membrana limitans externa. This is a sensitive outer segment of rods and cones, and this is the inner segment of rods and cones. You see here the MD, the perfect membranous discs in the outer segments of rods and cones. Yes, yes, yes. This is a connecting stalk with the basal body and a cilium between the outer and inner segment. And you see many mitochondria, rough endoplasmic reticulum, Golgi apparatus, yes, everything present here, yes, 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 in the inner segments of rods and cones. Then is the body and the nucleus of rods and cones. So you know this is the fourth layer, and this is the outer nuclear layer in the retina. So rods are containing such globular molecules on the membrane with this pigment rhodopsin. Yes, rods and cones. You have around 120 millions of rods in your optic part of the retina. In cones, this pigment is iodopsin. Visual pigment is iodopsin in cones. Thanks to light, these pigments are broken down to two parts. One part is such a membrane protein opsin, and the second part is 11-cis retinol. 11-cis retinol is the second part. And then here you have a little bit explained the physiology. Yes, little bit of the phototransduction. So we have 3 types of opsins. 3 types of opsins. So it means we have 3 types of cones, which are less number, 6 to 7 million cones in your optic part of the retina, against to 120 million rods, please. So there are many more rods than cones. Yes. In darkness, rhodopsin is not activated, please. Rhodopsin in darkness is not activated. And the result is the opening the channels for sodium, yes, sodium, potassium, and on the membrane is normally running the depolarization. And those short axons are here in synapses with the dendrites of bipolar neurons. Yes. So the EF inner fibers are in fact such very short axons, because once more, rods and cones are primary sensory cells, like the cells in the olfactory epithelium. The sensory cells in the olfactory epithelium and rods and cones are primary sensory cells. The cells in the taste buds and in the inner ear, the hair cells, are secondary sensory cells. They are modified epithelial cells. but primary sensory cells are modified neurons. This is macula lutea. Yellow spot. Yellow spot. It's in this place, in the eyeball. It's in this place. Very near the blind spot. Very near the blind spot is this yellow spot. And you see here that he is very nice place for very sharp sight, thanks to one cone connected to one bipolar neuron, connected to one ganglionic cell. Here, of course, you see once more the pigmented epithelium, the first layer of the optic part of the retina. And very near is the blind spot, the papilla optici nervus optici. So here are running out the axons from the ganglionic cells. Yes. Many axons coming out from the ninth layer and forming the optic nerve. Approximately from this place, they are surrounded by the myelin sheath. For the myelin sheath are responsible, please, oligodendrocytes, because we are in the part of CNS, not Schwann cells, oligodendrocytes. And the second important information, you can see on the surface a very thicker layer of dense connective tissue, dura mater, under the arachnoid, and on the surface a thin layer of pia mater. So the mannings are surrounding the nervus opticus. So this is the blind spot in your eye. You hear through the center is coming out and bringing blood, arteria centralis retinae, coming out the blood, vena centralis retinae, bringing the blood out. So a very important nutrition for the big part of the retina in this moment. Once more a detail of the blind spot and the start and the beginning of the nervus opticus. So here you see all the layers of the optic part of the retina. You see how the layer number 9 is now very thick, because here are many axons from the whole retina coming and forming out the optic nerve. In the optic nerve are plus minus about 1 million axons from the whole optic part of the retina, about 1 million axons. So, once more, he is starting pia mater on the surface, arachnoid and dura mater, mannings. You see the nuclei of many oligodendrocytes, because they are forming the myelin sheath around the axons in the optic nerve. Now a very important information, that here you see the pigmented epithelium, the first layer of the optic part of the retina. You see here layer number 8, the ganglionic cells. You see layer number 9, the axons, and you see the inner limiting membrane number 10. So this is just repeating all the layers from number 1 to number 10. And the borderline is somewhere here. This is interesting. The borderline is somewhere here. That means above rods and cones. Above rods and cones, you see these are the nuclei, the bodies of rods and cones. So this is logically the outer plexiform layer. Outer plexiform layer. And here is somewhere the borderline. That the rods and cones, pigmented epithelium, rods and cones are getting nutrition from the choroidea, from the capillaries. This layer is called choriocapillary layer. This is the Bruch's membrane, and the nutrition is coming from blood from the choroidea for the pigmented epithelium and for rods and cones. The rest, bipolar neurons, Miller cells, ganglionic cells, horizontal cells, amacrine cells, are getting nutrition from the vessels from the retina, from this place, from this side, from this side. You see the capillaries. And this is getting the nutrition from the capillaries, from the choroidea. And why I'm speaking about this scheme, why it's so important to know this, because here you see what can happen. Can happen the retinal detachment. That means the optic part of the retina can suddenly fall away from the pigmented epithelium. Here is the first layer. Pigmented epithelium is staying. But now suddenly you see the space between pigmented epithelium and rods and cones. It's called the subretinal space or intraretinal space. And this can happen very simply with an unpleasant injury when you hit yourself in your head from front, or you fall on the head on the ground. So can happen very easily the detachment of the optic part of the retina, because if you remember, between rods and cones, these are the outer segments, between rods and cones and pigmented epithelium are any cell junctions, any desmosomes, any zonular adherents, any cell junctions. The rods and cones are just sitting on the pigmented epithelium. And be careful in your life in those unpleasant injuries, because in this moment this happens. The fluid from the vitro, here is the vitreous body of course. The fluid from the vitreous body will fill this intraretinal space. And what is ending very easily for rods and cones, what is ending very easily? The nutrition from the choroidea. And when the nutrition is not coming anymore to rods and cones from those capillaries, of course, your rods and cones in this place where it happened can easily, definitely die. And you can come partly blind or definitely blind in this moment. So be careful on this retinal detachment, please. Yes, very carefully. A few last words about retinopathy, because I think that diabetes mellitus is a very unpleasant disease which is rising on in more and more patients. I would say in Czech Republic it's a very interesting situation that each month new and new patients has got diabetes mellitus, this disease. And of course with this disease we can have this diabetic retinopathy about few years developing, slowly developing after few years living with diabetes mellitus. Even can happen, is possible, definitely, at some percent of patients can happen after 10, 15 years with diabetes, the definitive blindness can happen, please. So this disease is developing slowly but steadily, and what is important, the patients should go regularly in time periods to control the back eye ground. On ophthalmology, they should be controlled once in a half year, once in a year, as the doctor will tell them, or how this diabetes is developing, how often they should control the background of the eye. Very important. And to study the vessels in the retina, to see the vessels in the retina. This is important to control. Now, so the capillaries can change and starting the edema in the retina. Then you can see on the background of your eye, you can see lipid substances, nice lipid substances, and they are called hard lipid exudates. This is seen already on the background of your eye, hard lipid exudates. Now, then can completely close the vessels in the retina, and of course the body is reacting by building new vessels, but in front of the retina, in front. They can crack, bleeding into the vitreous body, and this blindness can come very easily. Also can happen retinal detachment of the retina. Yes. So please, this is a diabetic retinopathy, a very unpleasant complications, or one of the complications during the disease diabetes mellitus. The vessels and the lipid exudates the vessels and capillaries and vessels in your retina. Here you see how the arteria centralis retinae is nicely dividing into branches in the retina. Yes, this is okay. Anterior, posterior branches, yes, dividing. And here, those yellow spots are the problem at the diabetes mellitus, which is the ophthalmology doctor see on the background, and those are the lipid exudates in the retina. So it can be seen. So it can be seen in on ophthalmology when they study the background of the eye at those patients. Let's move a few words about the ear. So, in fact, it's a very, very complicated structure. Very complicated structure. With three chambers. The first chamber is the meatus acousticus externus. Inside, air. The second chamber is the middle ear cavity. Middle ear cavity is or tympanic cavity, yes, the second chamber, of course, inside air. And the third chamber is the internal ear with its bone and membranous labyrinth. And in this bone and membranous labyrinth is a flute. So please, there are two chambers filled with air and the third chamber filled with fluid. The length of the meatus acousticus externus is around 22 to 25 millimeters. You see that I hope you know that the middle ear cavity, tympanic cavity, is connected by eustachian tube or auditory tube with nasopharynx. So I hope you know this. Nasopharynx is on this side, and on the lateral side is opening the eustachian tube, connecting the nasopharynx with the middle ear cavity. The borderline between meatus acousticus externus and the middle ear cavity is a tympanic membrane. Tympanic membrane. We are in this moment, in this system, we are in ospectrosum of ossis temporalis, or in another name, pars petrosa ossis temporalis. In the middle ear cavity, tympanic cavity, in the middle ear cavity, there are very important three ossicles. Malleus, connected to the tympanic membrane. Incus is the connection between malleus and stapes. And the third ossicle is a very interesting small bone which is called stapes. This side are called crura stapedis, and this is the basis of the stapes. And the basis of the stapes is connected to the oval window. Which is here. Yes. The basis of the stapes. And behind, you are in the inner ear already. So these are the three important ossicles in the middle ear cavity. All those very small muscles are present, musculus tensor tympani and musculus stapedius. As you know, this muscle is the smallest skeletal muscle in a human body. Musculus stapedius, the muscle fibers are long only few millimeters of this muscle. This is the wall of the meatus acousticus externus. So we are in detail in the wall of this tube. Epidermis is clear, yes, coming from outside, from the skin. stratified squamous keratinizing epithelium. Yes, you can even see the hair follicles. Yes, present. Yes, the basic cartilage of the basic skeleton is elastic cartilage, which you see here. And you can see the important ceruminous glands in the loose connective tissue here. So this is only a small idea of the wall of the external auditory tube or the external auditory meatus with the most important elastic cartilage which is present in the wall. Elastic cartilage is also present in the wall of the Eustachian tube. This is, I hope you know from anatomy the name of this bone. Squama ossis temporalis, and this is os petrosum, pars petrosa, and inside you see he has orientated the cochlea and the semicircular canals of the inner ear. Anterior, posterior, lateralis, 3 semicircular channels. So we are in this moment in pars petrosa ossis temporalis in this moment. And now let's concentrate on the inner ear, internal ear. So the bony labyrinth, yes, the bony labyrinth is very important, bony labyrinth. And inside the bony labyrinth is a membranous labyrinth, please. Yes, this is the first important names, bony and membranous labyrinth. So, 3 semicircular canals, anterior, posterior, lateralis. Inside, membranous ducts, that means the membranous labyrinth. Inside the bony labyrinth. 2 such interesting structures, utricle and saccule. Yeah. Connection from the saccule to the membranous labyrinth in the cochlea, and the membranous labyrinth in the cochlea is called ductus cochlearis, in another name scala media, but ductus cochlearis is the membranous labyrinth in the cochlea. What is still here? Oval window, yes, if you remember the basis of stapes attached to this oval window from the middle ear cavity. So in this inner ear is flute. In the membranous labyrinth is endolymph, and around endolymph is perilymph. So please, they are very important 2 flutes, endo and perilymph. Here are the turns, the screws of the cochlea around the basis, which is in the middle. The basis in the middle is a bone, which is called modiolus bone. And around this modiolus, you can see 1, 2, you can see 2.75 turns, of the cochlea, with the membranous labyrinth in the center. 2.75 turns of the cochlea you see nicely around the center structure, which is called the modiolus, around this bone. Well, once more another scheme, yes, that now we are slowly coming to the places where we can find the secondary sensory cells in the membranous labyrinth, secondary sensory cells. Macula of the utricle, macula of the saccule, organ of Mr. Corti, inductus cochlearis, the organ of Mr. Corti, and cristae ampullares in the semicircular canals. 1, 2, 3, 4, 5, 6 places where we can find secondary sensory cells, secondary sensory cells in the inner ear. So here you see cristae ampullares, yes, in the semicircular duct. This is the membranous labyrinth, and here is the ampulla. And this place is called the crista ampullaris, crista ampullaris. So, if you remember, inside the membranous labyrinth is the endolymph, around is the perilymph. And we can see the secondary sensory cells, so-called hair cells. We have two types of hair cells, two types. The type 1 has a flask-shaped body. Type 2 has a cylinder-shaped body. So you see two types of hair cells in the ampulla and in the macula of the utriculus and the macula of the sacculus. And next important thing are supporting cells, which you see around. Supporting cells, yes, supporting cells are present around those secondary sensory cells. On the apical surface, it's the same here and here. There is a system of prolonging stereocilia, prolonging longer and longer stereocilia, ended by a real kinocilium, a right kinocilium with a basal body and the axonema. So this is a typical sign for the hair cells in the ampullas and in the macula of the utricle and macula of the sacculum. There is a real kinocilium on the ending of several long stereocilia. So these otoconia lying in the endolymph are such small structures composed from calcium carbonate and some types of proteins, which are lying above the stereocilia, above the kinocilium, as you see here in the endolymph are lying those otoconia. Yes. And let's move to the end. Yes, I don't want to be too long, so I'm already long. So let's move to the organ of Corti, into the cochlea. So this is the membranous labyrinth, ductus cochlearis in the bone labyrinth. The organ of Mr. Corti you see at this place. Yes. The cells are sitting on so-called membrana basilaris. Please don't mix membrana basilaris. It has nothing to do with a basement membrane under an epithelium. This is completely something else, a basement membrane, but this is membrana basilaris, basilar membrane. This basilar membrane, as you see, is very important, a borderline between ductus cochlearis and scala tympani, which is always under ductus cochlearis. And next membrane is a borderline between ductus cochlearis and scala vestibuli, which is always above ductus cochlearis, and this is membrana vestibularis of Mr. Reisner, the Reisner's membrane or membrana vestibularis. So, scala vestibuli, ductus cochlearis, scala tympani. This is one level in the cochlea, one level in the cochlea. Above the cortis organ is a tectorial membrane, membranatectoria, tectorial membrane. Yes, you see it in ductus cochlearis. This place on the side is called stria vascularis, the place of the production of endolymph. Inside here is endolymph in ductus cochlearis, and in scala vestibuli and scala tympani is perilymph, please. So this place is called the prominence, yes, and this is the next important thing here, accumulation of bipolar neurons. Ganglion spirale Cochlea. Ganglion spirale Cochlea. So here are bipolar neurons, and their dendrite is running to a hair cell, because there are secondary sensory cells, the cells here in the organ of corte, this is the nucleus, and the dendrites are running to the hair cells, and here are synapses. Here are synapses between the secondary sensory cells and the dendrites of bipolar neurons, and the axon is then running out, forming the part of the important nerve number 8. So you see here the same membrana vestibularis, membrana basilaris, the ductus cochlearis, where is present endolymph, and in scala vestibuli and scala tympani is the perilymph. Yes. Stria vascularis is clear. Spiral ligament is here. The prominence is here. And now the very important organ of corte, sitting on the basilar membrane. Sitting on the basilar membrane. In detail, we are running down in detail. So you see the tectorial membrane, yes, yes, yes. And you see the outer hair cells in several rows. Here we see 3 rows of hair cells on this picture. Inner hair cell is always 1 row of cells. We see the most important pillar cells, yes. Inner and outer pillar cells, and this is a inner tunnel, yes. This is the space of Mr. Noel. I will make a small n. And then this is the inner tunnel of Mr. Corte. So here on the side is the outer tunnel of Mr. Corte. Yes. Second important thing is now here written. These hair cells, outer and inner hair cells, has got only stereocilia, please. Has got only stereocilia. On those hair cells is missing the kinocilium, is missing, is not present, which is present in the hair cells in macula utriculi, macula saculi, and in the ampulla. There is a kinocilium, but here only, please, stereocilia. Only stereocilia on the apical surface of the hair cells. The supporting cells are called phalangeal cells. Of course, we can distinguish outer phalangeal cells and inner phalangeal cells. Here you see a nice detail of the organ of Mr. Corte. So these are the outer hair cells, 1, 2, 3. The outer phalangeal cells. This is the tunnel of Mr. Corte, the inner tunnel of Mr. Corte. Yes. Yes. This is the space of Mr. Noel. Yes. Good. These are the pillar cells, outer and inner pillar cells. Yes. The very high columnar cells are next supporting cells, which are called after Mr. Hansen. The smaller cells, which are more out, are called Claudius supporting cells, and under them are lying cuboidal shaped cells of Mr. Becher. So you see some gentlemen were very important studying the inner ear. So not only Mr. Corte, but also Mr. Noel, Mr. Hansen, Mr. Claudius, and Mr. Becher. So some cells are called after them. This is the Membranatectoria, tectorial membrane, and you see how the stereocilia are touching the tectorial membrane. The system was described slightly here. Yes. Yes, they are attached to the tectorial membrane. Yes, it's also vibrating because the endolymph is vibrating in this moment. So action potential has to be the result. Yes. From the light microscope, the last picture, you see the membranous labyrinth in the cochlea, ductus cochlearis, here. Stria vascularis, membrana vestibularis, membrana basilaris, organ of Mr. Corti, Membranatectoria, tectorial membrane, scala tympani always under, scala vestibuli always above ductus cochlearis. Ganglion spirale cochlea with many bipolar neurons, and there are dendrites running and attaching to the hair cells, outer and inner hair cells in the organ of Mr. Corti, from the bipolar neurons. Thank you for you listening. Sorry it was 15 minutes longer, but I think I've told you the basic informations and the basic structures and histological description of the basic structures, a little bit in the eyeball, and little bit we have then moved to the ear. So thank you and goodbye.